morning, gentlemen. I'm honored to be here today to talk about an issue that is becoming more and more prevalent in the world today, that is erectile dysfunction. But before I get started, I'd like to tell a funny little story. My wife said that I could tell this, so with her permission, I tell this story. A little while ago, I was talking to an older gentleman, and I saw that his zipper was undone on his pants. And so I suggested that he zip his pants up. And he looked me straight in the eye as he was zipping his pants up and said, "What can't get up, can't get out." So, on that note, we'll get into some of the major risk factors that contribute to erectile dysfunction. Erectile dysfunction is defined as the consistent or recurrent inability of a man to attain and or maintain penile erection sufficient for sexual activity. So, as men, we understand that in order to be pleasurable in their sexual activity, we need to be able to ejaculate, and also for our partner to be able to obtain their maximum amount of pleasure as well, we need to maintain an erect penis. And so erectile dysfunction is when you are unable to maintain that erection long enough to obtain this pleasure. In one study in Massachusetts, the statistics showed that 50% of men at the age of 50 years old, 60% of men at the age of 60, and 70% of men at the age of 70 have erectile dysfunction, which is kind of staggering because, I didn't think that was going to be like that. So we can see that erectile dysfunction is very, very likely that someday each of us in this room of 20, 30, 40-year-olds, we could one day have erectile dysfunction. So some of the major contributing factors that will be discussed today are decreased levels of testosterone, cardiovascular disease, hypertension, obesity, diabetes, and smoking. And now each of those play a factor in erectile dysfunction because as younger men as we are, we have the opportunity to avoid these contributing factors so we can lessen our likelihood of having erectile dysfunction. So before we get into those major risk factors though, we'll talk about some of the normal penile erection. To start, we'll look here at sexual arousal. When men are sexually aroused, the parasympathetic system will cause the release of nitric oxide, which comes from the blood vessel walls. That release of nitric oxide will increase the levels of cyclic GMP, which is a nucleotide. That cyclic GMP will activate protein kinase G, which then in turn activates a whole cascade of proteins, which then leads to proper erection. Once ejaculation occurs, the phosphodiesterase activity will come in and it will inactivate and lower the cyclic GMP levels, which will lower the PKG levels and lead to a loss of an erection because of that protein cascade, which will not be turned on. So at this point right here is where the blood flow will enter into the penis during an erection, and in the loss of an erection, the blood flow will flow out of the penis. So decreased testosterone is the first one. We'll look over here at this study by Revajewski in this table. We can see that these are the levels of testosterone, the concentration in the men. This study was done on Polish men older than 65. And in this study, lower than 250 nanograms per deciliter was considered decreased amount of testosterone. And you can see 95 men and 49 men here that fell into that category. And we can see that 33 and 17 of those men had erectile dysfunction. We can also see, though, that there are lots of other major factors like obesity, smoking, hypertension, and cardiovascular disease that play a factor in erectile dysfunction, along with the decreased testosterone. So testosterone, what its effect is on the physiology is that when it's decreased, it will impair the release of the nitric oxide right here. And also it'll alter the PDE5 or the phosphodiesterase activity, which is right here, and impair the cavernosal nerve function. The cavernosum is the penis, that's just the tube inside the penis where the blood flows in, and contribute to a disease in the penis that can occur. So essentially, the decreased testosterone will affect many different aspects of the normal penile erection, the nitric oxide release, and the phosphodiesterase activity. Cardiovascular disease and hypertension are perhaps the most dangerous of all of these that I was talking about today because it can lead to atherosclerosis, or the plaques that build up inside of the blood vessel linings, which cause narrowing and hardening to occur. Over here in this figure, we can see we have an artery, and then on the inside, this yellow substance, that's the fatty lipids and just debris, just junk that is the plaques that's building up inside of the arteries. And so with that plaque, as it builds up into there, it decreases the blood flow, so the blood can't get into there as well, and it also decreases the permeability of the blood vessel walls. So that means that the nitric oxide won't be able to be released, and also that less blood will be able to flow in. And in the penis, this is a major issue because if you decrease the blood flow, you're going to decrease the erection, but also if you decrease the nitric oxide release, you'll also decrease an erection because that activates the cascade event. Hypertension also leads to loss of blood vessel permeability via oxidative stress. Oxidative stress simply is there's reactive oxygen species that are in the body that will react with ions and cells throughout the body and cause hardening to occur. So antioxidants, drinks that are fruits that are antioxidants will help to reduce that. So we can go back to this again and we can see that the nitric oxide release is impaired due to atherosclerosis. Obesity is another major factor that can lead to erectile dysfunction, and it is estimated that 10 to 30% of people in developed country are obese, with an additional 16 to 33% of those being overweight. And adults older than 60% in the United States, 37% of those men in 2010 had obesity. So obesity, what that is you'll get a glucose intolerance, and that'll lead to the vessel obstruction. Similar to the atherosclerosis, you'll get the plaques that build up, and you'll decrease the permeability. In this study here by Larson, we can see that there were 6 countries that we got the data was pulled from, and the men with erectile dysfunction, the percentage of men with erectile dysfunction was plotted against their body mass index, so their weight, normal weight, overweight, or obesity. And so normal weight men, there was a negative correlation between erectile dysfunction and normal weight, so it wasn't really a causal thing. But with overweight men, it was slightly positive, basically a straight line though, so not really causal. But with overweight men, so obese men, you can see a very significant, straight positive relationship between men with erectile dysfunction and obesity. And especially here in the United States, you can see that 25% of men with erectile dysfunction were obese. So that men, us in the room, all men in the United States, we have a higher likelihood than other countries. Diabetes, in 2011, the CDC found that 25% of the US population over 65 has diabetes, and this is due to poor glycemic control. Well, the poor glycemic control, basically if you're not regulating your blood sugar levels, can lead to accumulation of plaques and atherosclerosis, which will again decrease the nitric oxide levels and activities. And this was a very interesting statistic that men with diabetes are 4 times greater of developing erectile dysfunction 15 years earlier compared to men without diabetes. So we need to avoid diabetes, type 2 diabetes, and eat healthy. And in this table we can see the association between potency. Potency is basically your ability to have a proper erectile function, and your glycemic control, good, fair, or poor. And so with this you can see that men that had good control of their blood sugar levels or their glycemic control had higher potencies than men that had poor control of their blood sugar levels. They had, 75% had poor potency or erectile dysfunction or some type of dysfunction in the penis. Smoking, in 2017, 15.1% of all US adults and 16.7% of males were current smokers. Right, in 2015, the CDC put that out. And the chemicals that are found in smoking can lead to atherosclerosis again and the blood vessel destruction. This one, along with the diabetes, which maybe I didn't mention, but in diabetes your blood vessels will begin to degrade and your nerves will degrade as well. And same with smoking. If your blood vessels degrade, then in the penis you won't be able to get the blood flow in and you won't have a proper erection. Current smokers within the age of 40 to 49, so that's some of us in the room, but also most of us are younger than that, so we need to make sure we can avoid this. They were at the greatest odds of an erectile dysfunction with an odds ratio of 2.74, which is really, really high. Treatments. This is kind of a funny treatment, but in 1600 BC, the Egyptian cure for impotence involved rubbing a mixture of baby crocodile hearts and wood oil directly onto the penis. Obviously not scientifically proven, but for them it worked, I guess, so it's kind of interesting. But some of the three main big ones that are used today are PDE5 inhibitors, topical prostaglandins, or ejection therapy. PDE5 inhibitors, that's the phosphodiesterase activity, and if you inhibit that, we can see here, then you'll keep your cGMP levels increased, which will allow the erection to last longer, and you'll have proper erection, until you can ejaculate. But also topical prostaglandins and ejection therapy, those are potent vasodilators, which will basically bring the blood into the penis. And when the blood flows into the penis, that's what causes the normal erection to occur. So Viagra is an example of a PDE5 inhibitor, so very common. So this is the normal penile erection again, and basically what we've talked about, if we can prevent, or the treatments are used to allow better release of nitric oxide and to prevent the degradation of these proteins right here. So what does this mean for you? You can prevent atherosclerosis. Three of the major ways you can do that is eating a healthy diet, exercising regularly, and don't smoke. By doing these things, you'll be able to not be obese, you'll be able to not have diabetes, and smoking, you'll just have a healthier life as well. And hypertension will be decreased as well. And also you need to consult your healthcare provider regularly. Don't feel ashamed about this, men. It happens all the time. And go and talk to your doctors. And in conclusions, these are the major contributing factors. Obviously there are more, but these are the ones that we focused on today. Low testosterone, obesity, cardiovascular disease, diabetes, hypertension, and smoking. And that is my presentation. Thank you.